These might be the most frequently asked questions that you might have occurred, but we want our readers to know about it. What does it mean to have mental illness?
Um, well, when you have a mental illness, you're basically not in a position to function as well as you would have if you didn't have it. So there are a whole bunch of things that we can look at. We can look at a person who's more anxious than normal and because of his anxiety restricts his activities. You can be depressed and not want to do anything. You can have obsessive thoughts and compulsive actions which make you do the same thing over and over and over again. There can be paranoia where you're suspicious of other people's intentions and you're constantly thinking that they're after you, against you, and so on. You can have a substance issue, you take drugs or you're on alcohol or things like that, which can cause its own problems. There are a whole bunch of personality disorders where you land up behaving in a way which is inappropriate and having problems with relationships. In children, you can have problems with concentration, you can be extremely restless. There are conditions where you have something called autism, where there is a problem with a whole bunch of issues. For example, communication, proper eye contact, and things like that. There can be times when you're extremely angry, extremely aggressive, lose control over your impulses. There can be times when you're suicidal. All of these come under the gamut of mental disorders. And what also happens sometimes is that there is a situation where you'll end up having physical symptoms because of stress. So you're stressed out because of something and you'll end up getting a chest ache and a backache and a headache. And you go to an orthopedician or you go to a back surgeon or you go to a neurologist and they check out and they see that there's nothing really wrong with you physically, and then they might refer you to a psychiatrist. So you have these somatic symptom disorders as well, where the stress causes you to get physical symptoms.
Who does mental illness really affect?
Anybody, everybody. It affects anybody from any economic background. It affects both the sexes. It can affect anybody at any age. So just about everybody is susceptible to it.
What causes? What are the usual causes for it?
Well, usually it's multifactorial. There's probably a genetic component. There's certainly neurotransmitter issues. Sometimes it occurs after some kind of a trauma. Sometimes it occurs for no apparent reason. There could be structural changes in the brain. There could be different physiological processes that happen in the brain, which we are now seeing with certain conditions, with certain investigations like fMRI and SPECT scans. You can actually see what's happening in the brain. So it's usually multifactorial. It's very rare that you can say it's because of this one issue. It's usually this one issue plus a whole bunch of other issues occurring as well.
Could you share some of the warning signs that perhaps,
Well, we have a lot of warning signs. Supposing you find a person who can't sleep very well, can't eat very well, seems very depressed, seems to be very quiet. Or at the other extremity, somebody who's extremely excited, who runs around doing a lot of stuff, but it's not all goal-directed, who lands around believing that he's the answer to the universe, that he has the answers to everything, that he knows what to do in case of a calamity. He hardly sleeps, he eats too much, he's very hypersexual. That could be a problem. You can have kids who can't sit properly, who have concentration issues, who have problems in spite of the fact that they seem very intelligent, who have problems with studies much more than what they should have. You can have people who talk about their palpitation, who are constantly anxious, who have this feeling of what we call impending doom, something bad is going to happen. We have people who are constantly hand washing, constantly checking, constantly counting. They keep doing the same repetitive behavior over and over again, because if they don't do it, they'll end up feeling very anxious. You have people who are constantly smoking, constantly drinking, on drugs, and they have their own attendant issues. You have a whole bunch of people who are constantly seeming to have physical problems. So they talk with great excruciating detail about how a pain comes up from here and goes behind here, and this happens here, and there's a tingling numbness over here, and you feel funny over here, and nobody takes them seriously, etc., etc., and you investigate them and you find there's nothing organically wrong. And you have people who are suicidal, which is becoming one of the biggest things, unfortunately, in our field. All of these can be very important signs and should make you move towards seeking an evaluation and help from a mental health professional.
Can people really completely recover?
Of course they can. Of course they can. Maybe not everybody, but there's a huge percentage of people that recovers completely, and there's a large percentage of people that recover almost completely. There's a small percentage of people that might need constant medication, have a few relapses, have ups and downs, and there's a very, very, very small part which would need institutionalization. But I'd say about 70-80% of people do brilliantly, provided they seek help early enough, take the medication properly enough if medication is indicated, and so on. If you do your own thing because you believe you're Dr. Google, then you're not going to recover properly.
How do you suggest that people help themselves? Some of the basic things.
Well, I think what is important for us is to be aware of the fact that mental illness exists. Denial is one of the biggest things that comes in the way of your treatment. So you should be aware that anybody is susceptible to the disease, to the disorder, and some people are more susceptible. If there's a genetic thing, if somebody in the family has it, if you've been under tremendous chronic stress for a very long time period, etc., you can be a little more susceptible to it. What I suggest to everybody is try to live as normal and as regular a lifestyle as you can. So eat properly, sleep properly, X amount of hours, do some amount of physical activity on a daily basis, have fun as well. A lot of people who come to us now have become such workaholics. They somehow believe that the company is going to close down if they don't work as much as they're supposed to, and they're always on call. You need time off. It is imperative for you to recharge your batteries. It's imperative for us to socialize, have fun as well as work. The other end is also true. You can't only have fun. So there has to be some amount of balance that we find in our regular lives, which then helps us and hopefully will maintain most of us the way we'd like to be maintained. In spite of all of this, if you still find that there are signs and symptoms of you're having some kind of psychological issue, let's not get into what will people say and how will I cope and what will happen. Go get an evaluation, go get a diagnosis, go get the treatment, and then we'll see, and then you will see how much better you feel.
How are treatments easily available in India?
Of course there are. I mean, treatments easily available, meaning all general hospitals have a psychiatry department. There are a lot of private hospitals which have it as well. There are a lot of doctors available. We're looking at psychiatrists, psychologists, and so on. So there's a lot of help that is available. And now, one of the good things on the net is that if you type in your area and you type in the kind of doctor you want to see, you get a whole bunch of them. Then you can choose and go and see them. So certainly it's available.
What is, if somebody is suffering from mental illness, what should they expect from the treatment? What should be the course of treatment?
Well, the first thing that they should expect is that their proper evaluation will be made. The evaluation will certainly be a clinical evaluation, which the person will talk to you. In addition, there may be some tests that you might have to do, which are both psychological as well as tests like maybe a CT scan or an MRI or certain blood tests or things like that. Once that is done, you have to expect that nothing occurs with a shortcut. So if the doctor tells you that you have to undergo this kind of treatment, undergo this kind of therapy, take this medication for an X amount of time, come back at regular intervals, it is essential that you follow the treatment that is being done. If the doctor says, and he probably will, that you're not supposed to have alcohol with it, try to reduce your smoking, certainly don't have drugs, it's essential for you to do it to the best of your capability. If the doctor says have it at 9 in the morning and 9 at night, you cannot say, but what if I have it at 12 in the morning? Why would you say a thing like that? So you have to follow instructions. You have to expect that the doctor is going to do the best that he can given his past experience and the research and the stuff that he has studied to enable you to live as normal a life as you can possibly live. You have to, of course, follow up, but not irritatingly so, which means not every day send a message saying this is happening, that is happening. Give it some time. We are doctors, we are not magicians.
When it comes to seeking the right professional for your child, Like, because there are different types of mental health professionals. So how do you differentiate and figure out?
Well, I probably say that the top level goes to the doctor, and then you have the psychologists, the counselors, the special educators, and so on and so forth. So, if there's, say, just a problem with a little bit of concentration and the kid is not doing as well, then maybe you'd first go to a psychologist, get an evaluation done. If the evaluation shows evidence of something for which medication is needed, of course, you'd go to the psychiatrist. In a case of depression, or anxiety, it's useful to first go to a psychiatrist who will then be in a position to state whether medication is necessary or whether some kind of therapy is indicated. You must realize that the psychiatrist is in a position to maybe be a little more aware of the modalities of treatment because he's a doctor and he's studied the best of both the worlds. We have fantastic psychologists as well as fantastic psychotherapists, but I probably suggest that the first initial evaluation should be by a doctor who would then tell you where to go if he feels it's not necessary for him to do anything. I mean, about 20 to 30% of the people who come to me, I say, you don't need to come to me after an evaluation, go X, Y, Z.
Been closely associated with the Indian Psychiatric Association. What are the upcoming programs that perhaps should be helping?
I think we have programs happening all the time. We've had programs relating, depending on the zone that you are in. Very recently, there was a program on the LGBT thing. There's been programs on depression. There's been programs on child psychiatry. There have been programs on marital issues. In Bombay, we've had issues even in the psychotherapeutic things so that we can brush up on our skills. So everywhere across the country, you have programs happening depending on the zone that you're in. You have a West Zone, East Zone, Bombay Zone, things like Central Zone and things like that. So there's an enormous amount of stuff happening. It's always there on our websites. You can attend even if you're not a medical person, but by and large, it makes much more sense if you have a psychological background because it will be much more relevant to what you're doing and the kind of work you're doing. We also have task force and action groups. So you might have a task force on, say, biological psychiatry, something on child psychiatry, something on counseling, something on sexual issues, something on geriatric psychiatry. So depending on your bent of mind and your interest, obviously you will attempt to attend more of the stuff that you're interested in. So everything is available and people keep attending. And now since the governments have made it mandatory that we have to attend X amount of conferences anyway in order for our registration, we have to have continuous medical education stuff. More and more people are attending, more and more things are happening. So there's a lot happening in our field.
Thank you so much for talking to us.